It is easy to take for granted living in such a beautiful place. To go on a walk with the dog 5 nights a week, to see the fall colors changing and watch the lake. To me, being a pediatrician is kind of a sacred position that people trust. When someone brings their child to you, this is the most important thing in their life. I'm Madison Orsburn. I'm a general pediatrician in Russellville, Arkansas, and I work at Millard Henry Clinic. Usually the hardest part of my job is almost always the parents. The parents are the ones who are worried or who have questions, and it's usually after a long night. Their kid's been up with fever. They've maybe read something online about what they think it is, and it's always the scariest thing. I think the access to information, while it's amazing, is also really confusing, anxiety-provoking, and they don't necessarily have a good resource to know what is true. And so I think that's where they come to me as a resource they can trust. The hardest thing about kids is that up until they're 2 or 3 years old, they really can't tell you what's going on. And so you have to become sort of a detective. You have to know how to recognize signs and symptoms that things are just a little off, and know when that needs a workup and know when it's normal. I had a 2-week-old one time who came in, and really the only thing the parents could tell me was that something was off. The kid had maybe a little runny nose and they weren't eating well, they were a little fussy. In the back of my mind, I know what that can mean. I know that a 2-week-old in those first couple of weeks, that's the time that metabolic conditions or genetic conditions or just random sepsis can happen. When you have a 2-week-old who is sick, especially if they're running fever or they're showing more symptoms, you're obligated to do more invasive things. You have to get blood cultures, you have to start antibiotics or do catheter urine test or even do a spinal tap to rule out meningitis. But I got to asking some questions. We found out that one of the older siblings had actually just gotten over a pretty nasty respiratory virus. So we did a 4-plex test where we tested for flu, COVID, and RSV, and sure enough, it was RSV. Any tool that I have in my arsenal, like a PCR, that allows me to sit across the room from an anxious parent and look them in the eyes and say, we're gonna find out what's going on with your kid, we're gonna figure out how to make them better. And I can say it with confidence, is hugely important to me. I don't consider my job done until I can really close the book on a diagnosis. And so it's really nice to have that PCR with incredible sensitivity, and I can do that and say, we'll close the book on this today. We can move forward with our treatment plan. I consider myself part of this community, and as a part of this community, I have an obligation to provide the same quality of care in Russellville, Arkansas that you might get in New York City or Dallas or Los Angeles. These are not just patients, they're often my friends or family, and so I want for them to say, we've got a resource here that can give us just as good a diagnosis and treatment as we could get anywhere in the world.